Top face mask myths you should know. Wearing a face mask is mandatory now in many places where social distancing isn't possible, like in the grocery store or hair salon. But let's be real for a second. Face masks suck. They are uncomfortable, especially in the heat, and they prevent you from gazing upon the beautiful faces of people you're no longer allowed to get within 6 feet of, among other inconveniences. But wearing face masks combined with other preventive measures such as frequent hand washing and social distancing can help slow the spread of the coronavirus. The Centers for Disease Control and Prevention recommends that everyone over the age of 2 wear a mask while in public settings. Though we still have much to learn about the coronavirus, misinformation about face coverings are circulating. As an example, some people who are opposed to mask wearing have begun donning mesh masks that cover their nose and mouth but still allow through the kinds of droplets known to transmit the virus. That's a myth that isn't supported by leading health experts. Now guys, let us discover the facts behind the myths about COVID-19 face masks. But before we continue, please subscribe to Starface Productions and hit the bell icon for more video updates. These are the top face mask myths you should know. Number 11. Cloth masks don't protect you. Cloth face masks are effective. It will create a barrier between your mouth and nose and those around you. Studies indicate that they may help protect you from large droplets and serve as an indirect reminder to avoid touching your face. Number 10. Wearing face mask causes a person to breathe in more carbon dioxide. Some people have suggested that carbon dioxide from exhaling gets trapped under the mask and can make you sick.
People to put masks on our face to keep us from breathing oxygen to get us to become sickly.
Well, that's not true. According to the WHO, prolonged use of surgical masks doesn't lead to CO2 intoxication or lack of oxygen. Just make it sure it fits properly and that it is tight enough to allow you to breathe normally. Do not reuse a disposable mask and always change it as soon as it gets damp. Number 9. The way you wear a mask is not important. The correct way of wearing a mask is the key to preventing the spread of COVID-19. According to the CDC, a cloth face mask needs to have the following to be effective. Cover both your nose and mouth, fit snugly but comfortably against the sides of the face, be secured with ties or ear loops, have multiple layers of fabric, allow for unrestricted breathing, able to be laundered and machine dried without damage or shape changes. Number 8. People don't wear face masks if they don't feel sick. That's not true. It serves as added protection because the virus is thought to spread easily between people who are in close contact with one another by respiratory droplets produced when an infected person talks, coughs, or sneezes. In other words, if you're not wearing a mask and you breathe in the same air as an infected person who also isn't wearing a mask, your risk of acquiring the coronavirus increases. Number 7. Babies should wear face masks. Children under 2 are not advisable to wear a face mask. As per said by the CDC, neither should anyone who has trouble breathing or is unconscious, incapacitated, or otherwise unable to remove the mask without assistance. Number 6. A loose-fitting mask works just fine. Nope, not right. The key to wearing a face mask fits snugly but comfortably against the side of the face, says the CDC, and completely covers the mouth and nose to help prevent respiratory droplets from escaping. That said, it's important to make sure you can breathe without restriction with it on. Wearing a face mask does not need to social distance, or stay-home masks are just one piece of the strategy for preventing the spread of the coronavirus. Unfortunately, they won't prevent anyone from coughing or sneezing on you, and they may not prevent you from getting sick. So it's important to follow all the recommended steps for protecting yourself, including practicing proper social distancing when you're around others, not gathering in large groups, and washing your hands frequently. Number 5. A face mask just needs to cover my mouth. A mask should cover your mouth and your nose, of course. It should be snug but comfortable against the side of your face, and you should be able to breathe without restriction. Choose one that secures with ties or ear loops. Don't wear your mask around your neck or chin or over your head. That doesn't protect anyone. Number 4. We can clean the face mask in the microwave. Like a tasty bowl of mac and cheese? Definitely don't try this at home. It is not recommended and could be really dangerous. Dr. Swan says there's no guarantee microwaving a reusable mask will kill the germs on it. There have been stories of masks igniting in the microwave, which is not something you want to do, he told CoronaCast. What will kill most germs, in fact, what will kill the virus, is to wash your mask with detergent and water and let it dry. According to a health expert also says microwaving is not the best way to maintain your reusable masks. The coronavirus is actually reasonably easy to kill, he says. You don't need to go and cook it in the oven for hours at 200 degrees, which is more than likely going to burn down your house. You don't need to bleach it. You don't need to use top-of-the-range hospital-grade disinfectant. Anything other than an N95 mask is useless in terms of limiting transmission of the virus. Number 3. Wearing face masks cause self-contamination. The truth is, both myth and fact. It is because masks can become contaminated on the outside surface from the droplets mentioned above. If you do not handle your mask safely and use great hand hygiene before and after touching it, you could contaminate yourself by getting a virus off the mask, onto your hands, and into your eyes, nose, or mouth. This is the reason why washing cloth masks or replacing disposable masks is so important. But the idea that wearing a mask after you've been exposed to COVID-19 will increase your level of infection is a myth. There is no evidence to support this self-contamination claim. Number 2. We don't need to wear masks outside since sunlight kills the virus. Studies show that 90% or more of the SARS-CoV-2 virus will be inactivated after being exposed to midday sunlight for around 34 minutes. That's why some people believe that it is not necessary to wear face masks outside. But there is a catch. The study is only applicable to surfaces. This means sunlight won't stop someone from spreading the virus if they cough or sneeze near you while you're outside. Number 1. It's okay to touch the inside and outside of your mask or respirator when putting it on or taking it off. Just like you should avoid touching your face to help prevent contamination, you should not touch the inside or outside of a face mask or N95 respirator. With clean, sanitized hands, you should always pick up or take off the mask by its straps, ear loops, or ties. Always wash your hands or use alcohol-based hand sanitizer before and after mask respirator removal, and be conscious that the outside of the mask is a contamination zone. For purchased masks or respirators, always follow product instructions on use, disposal, and storage, and follow the procedures for mask donning and removal. Well, that's for the top face mask myths that you guys should just remember. It's our responsibility to protect others from what we don't know is in our breath. So wear your face mask properly and also practice hand washing. Don't forget to hit the thumbs up button and subscribe for more updates regarding COVID-19. By the way, please comment below of any misconceptions you've heard of.